Greetings, I'm Yvonne Stapp for Science for the Public, and I welcome you to Contemporary Science Issues and Innovations. Today, we learn about the World Health Organization and why a recent White House decision to withdraw the United States from the WHO is a serious mistake. And our guest is Dr. Davidson Hamer, Professor of Global Health and Medicine at the Boston University School of Public Health, and a few other academic positions. Dr. Hamer has a very long history with the World Health Organization, serving on numerous advisory boards to develop guidelines for children's health and for the protection of pregnant women and newborns. He has worked to improve the health of children for years, and especially in impoverished nations. Today, he will tell us about the World Health Organization and what it does, why it is so important, especially today, and his own research and work for that organization. Dr. Hamer, welcome.
Thank you very much for having me.
And before we get into the World Health Organization issue directly, could you give us a little background? First of all, a couple of things. First of all, the state of child health in the world, just in general, and perhaps especially impoverished nations. How healthy are children?
Oh, that's a complicated question.
I know.
Different ways to look at it. I mean, I think we often look at the burden of disease in children, but really the burden of under 5 child mortality.
Yes.
So a lot of the focus over the years, in particular with the Millennium Development Goals, was trying to reduce child mortality. And there's been some pretty good progress in that regard. Some of the major killers of children are neonatal health issues, some of which include infections, but also prematurity, and to a lesser extent, congenital diseases, or congenital malformations, complications of development or birth. But I mean, basically, what's happened is over the last 20 years, there's been this major focus on improving child health. It's succeeded, not everywhere and not to the extent that we'd like, but the newborn was sort of left behind. And so as a proportion of under 5 mortality, neonates now account for about like 45%, almost half. So that means half the deaths of children are occurring in the first month of life. Yeah, and that's why there's been a real push to try and look at improving pregnancy and the health of pregnant women, improving access to safe delivery and access to places where they can receive emergency care during complications, but also really focusing on what happens in the first few weeks of life. So that's just one aspect. I mean, I think that there are still a lot of problems with undernutrition in many parts of the world. Diarrhea, pneumonia, malaria still remain major causes of mortality. And in recent years, there's been sort of a move from a child survival agenda to a survive and thrive. So both survival, but also helping children to develop both early child development and then school-age children to help them have access to adequate education.
A lot of this is linked to poverty. Is that the case? In worldwide, so it is the nations that are poorer that have more difficulty securing the health of the children.
Yes, there's definitely a link to poverty and sort of insufficient resources.
Yes,
and then really access to care and access to services in many parts of the world. And I would actually throw in access to basic amenities, or what we would consider basic, which is safe water and then adequate sanitation and hygiene.
Right. It's the sort of things that the industrial countries at one time went through and have gotten past that, although I think children's health, even in this country, is probably not as good as it should be, but in any case, your concentration is on four nations. And so I would like then to to ask you about the World Health Organization itself. I think the public doesn't have a very complete understanding of what it does and how critical it is in the world. Could you give us that information?
Sure. I mean, the World Health Organization does a lot of different things. I mean, I think that, their overall goals are trying to sort of help, improve the health of populations worldwide, with a focus on individuals. And they do a lot of work with, I mean, first of all, the World Health Organization is really, it's an organization that is a conglomeration of input from member states. And so it's both the sort of technical input, but also financial input. And that's very important. I think one of the things that the WHO suffers from is it can sort of create guidelines and recommendations, but it doesn't have an ability to enforce things. That sort of trickles down to the member states. And we could go into specific examples, but that's one of the challenges. There are many different departments within the World Health Organization, and they all have a different focus. I mean, some of them are, for example, emergency response to pandemics or to emerging disease outbreaks. The group that I have worked with historically for many years is the Child and Adolescent Health Department, which is really the maternal, newborn, child, and adolescent health department. And so some groups are really focused on policies and maybe surveillance and guidelines, but others will be involved in research, collaborating with scientists around the world to try and develop evidence that's rigorous in quality that feeds into the guidelines that the World Health Organization releases. And then the World Health Organization, they create these really great guidelines. They have to be picked up and adapted and used by member countries.
That's an important point I think, because in a world that is very much interconnected, certainly in terms of disease and infections, as we are learning now, that you need guidelines and nations need to work together. And so that seems to make the WHO kind of indispensable. Is it very difficult to get nations to cooperate in this way?
It varies. Sometimes it is, but I mean, many countries, especially many, I would say, low middle income countries, will have what's called a representative from the World Health Organization in that country. And they're deeply involved in working with the Ministry of Health and other organizations, sort of high level ministries and political organizations within the country to help with adoption of their guidelines, perhaps local adaptations as needed, and then to serve as a conduit to sort of communicate to a higher level and actually there are regional offices for the WHO in many parts of the world, and then those feed up to the national office. So there's a lot of country level support that's provided by the World Health Organization in addition to sort of the high level guidance.
And before we go to your own extensive work in that organization, I'd like to get an idea of the commitment of the developed nations and their role a very important role, apparently, in sustaining the WHO. In general, the developed nations are on board about this? Are they committed, and they do help finance this substantially?
I mean, that's all correct. I mean, I think that WHO is basically funded primarily by donations from member states, and it's the high income countries like the United States, like many of those in Western Europe, that are the main source of funding for the WHO. And that's why the decision by the U.S. to pull out of the WHO and to stop funding it is really a very unfortunate and could be even disastrous, in my opinion.
Yes, I want to come back to this after we go through what you have done yourself in there, because that it seems to be a really critical, unprecedented kind of move and ominous. So I would like to spend time on that. You've been talking about this quite a bit, I think, and we appreciate your voice on it. Before we go back to that, could you talk about your own work, which is very extensive and very impressive? Your major stuff, is it research, or I know you're on advisory committees, you do all kinds of things, but what do you consider your work there?
Well, so the most relevant work is I've been working on maternal, newborn, and child health
Mm-hmm.
research for the last 25 years or so. And this, I've worked in several countries in Latin America, but primarily in Ecuador, very intensively in a number of sub-Saharan African countries, especially Zambia, but also a fair amount in Ghana, Nigeria, South Africa, Tanzania, Uganda, Kenya, and then also in Southeast Asia. In South Asia, I've done a number of studies in Pakistan, India, and Bangladesh. I currently have projects in Bangladesh, and then in Zambia that I'm working on starting, and also South Africa, working on starting a study in Tanzania soon. My work is really, I've done a number of different things, but a lot of it is really what we used to call policy relevant applied research. Now it's often called implementation research or implementation science. And it's really trying to do practical studies that lead to evidence that can be used to improve local practices, local guidelines, or international guidelines. And so I've worked on in malaria, malaria case management, improving access to malaria medicines, malaria prevention, especially malaria in pregnant women, to try and improve birth outcomes.
Yeah.
I've worked on childhood diarrhea, interventions to improve child pneumonia. And then actually one area that I've done a lot of work on that really I think is a great thing that developed really around 2008 to 2010. It's called integrated community case management. So it's basically using generally volunteer, although sometimes paid cadres of health workers in the community to deliver a simple package of interventions to improve child health that focus on malaria, pneumonia, and diarrhea. Sometimes adds a nutrition component or a young infant component. And that's been implemented by a number of countries in sub-Saharan Africa during the last decade. It has been supported by both the WHO and UNICEF. I've also done a lot of work on newborn health, trying to test interventions that lead to decreases in neonatal mortality. And then that's closely tied in with maternal health. So we've been doing a series of studies to try and improve access to mothers to emergency obstetrical newborn care in order to try and improve birth outcomes, but also to help the health of mothers. So I've really been involved in a pretty broad range of things over time. More recent years, actually, we're doing more work on early child development, trying to use different community-based strategies to help children in their first couple of years of life to improve their language, motor, and cognitive skills.
Yes, I have a question on that. This may not be the area sort of thing that you've worked on. We've been doing quite a bit on toxins like PFOS and bisphenol A and that sort of thing. And this is worldwide. It is affecting children in prenatal development. It affects their cognitive development. And I wonder if you are seeing these kinds of repercussions with this kind of abundant toxin in environments, and people are deeply affected. Children are deeply affected.
And that's a good question. I'm not sure. I mean, we have not looked at those toxins in particular, but I think it would be useful to do that. I am working with a team in Bangladesh looking at heavy metals.
There's another.
On both growth and cognitive development in young children. So that's an area. I mean, there's a lot of contamination of the environment in different ways.
That's just it. I was going to say mining, all of these bad water, all of this kind of thing, big farming. It's a really serious problem, and it does affect children very, very much. But in any case, you have cooperation. I'm very impressed that you work with the community, that kind of a strategy to involve people and use their local expertise, their cultural expertise, so to speak, and so forth. Do you see a better future? It just seems as though throughout my lifetime, this poverty has sort of stayed level, and people have great trouble getting out of, well, an exploitation trap, for one thing, being used by maybe developed countries to extract resources and so on. And meanwhile, the people are not getting rich there. But do you see that improving? Do you see health improving? And that's background situation?
It depends on the country. I think some countries have had a shift, so there's a growing middle class. There's some people that are being pulled out of extreme poverty, but then in other places it's just not happening, and there's an even greater and greater split between the really wealthy and the really poor.
That's it.
And so, I think overall the health of many populations in low-income countries has improved. It's still far from optimal, and I hate to say it, but COVID-19 is going to have a real negative impact in a lot of places. It already is happening.
Oh, this is hard to watch. It really is, because that would be like here, the vulnerable communities really get hit hard, very, very badly. In any case, then you've done all this work. You've committed a huge career to helping people and helping children develop. And they are conditions that we don't think about much anymore in developed nations, like pneumonia, diarrhea, for goodness sake, things like that. We don't even think about them anymore. We're not aware of them. So it is marvelous that you're doing it. I hope that you will be allowed to continue to do it, which brings us to this issue of the Trump administration claiming they are going to withdraw the United States. Tell us about that, please. What does that mean?
Well, I think it's really unfortunate. It's hard to tell what the implications are, except that the fact that I think the U.S. provides like maybe 20% of the World Health Organization budget. A big proportion. And W.H.O. budget, W.H.O. does so many different things at so many different levels.
Yes.
And they tend to use their resources carefully, generally.
Yeah.
And they're already resource constrained based on my work with the organization over time, and that this is going to make it even harder.
Right. That's a fifth of their income, for one thing. But another thing I'd like to ask there is, what does that do to the long range? A lot of the research and a lot of the policy development that you've been involved in and others have been involved in is long range. It's not a year here and 4 years there. It takes years to do this. How is that going to be affected?
Well, I'm not sure. I think that those many different groups are already working with the World Health Organization. And, as far as I can tell, if the U.S. is not a member, it doesn't mean that we cannot collaborate with the WHO. So I think—
you can.
Yeah. And so I think the work we're doing, the research and the development of guidelines and so forth, will continue. If we were banned from collaborating with the WHO, that would be even more disastrous, because there's a lot of scientific and technical capacity in the U.S. And there's that the WHO is able to access and use. That would be terrible if we were unable to do that.
Well, also, is there another, I'm not sure about this, they then make that information available worldwide. So people are doing research, it takes a long time, or people are setting up guidelines. So we get now a good policy to implement somewhere, and it's effective, but this is shared with all the members of the WHO, I think. Is that correct?
That's correct, yes.
Okay, and will you still have access and if we withdraw?
Yes, we would.
Okay.
The WHO is really good about doing everything open access. So
Yeah.
anybody has access to information that they have. They develop guidelines and manuals for various topics for say like there's a manual for treatment of severe malaria. And that I've had some input in over time. And that is, you can just go in and download that for free from their website. I mean, you can also purchase it if you want a hard copy. But so they provide everything is open to the public, and that's to anybody who can access the website. So I don't think that would be blocked. I think it's just that their ability to produce those guidelines and to disseminate them through various channels is going to be impaired by our not participating and also not providing funds.
Right, I see. So that's the catastrophe there. Then finally, so I understand that this withdrawal doesn't take place till after the election anyway, but if we get a different administration in, we can come back, we can join again if they do withdraw us.
That is my hope. Yeah, I mean, I think the answer is yes, that
right.
It's possible that we're not withdrawing officially until early
next 21 year. Or something. So yeah.
There's some time to change our minds.
Right, and very, very quickly, are other leaders of developed nations able to make a unilateral decision like that? Like in the EU, those nations, I have the impression even in Britain, you wouldn't, the prime minister or a president of another country would not be able to make that kind of decision unilaterally.
I think it may depend on the country. In the EU, yes, I agree. It may be difficult for the leader to make that kind of a unilateral decision. Whereas, if you were to go to a small country in Africa, it's a different story in terms of the
you also have like a dictator. But the thing is that into the developed nations, I don't think I've ever heard of a decision like this on the part of a leader being able to do something with such horrendous repercussions down the line that just wouldn't be allowed to do something all by him or herself. Okay, last thing. The public is not really in a position to mobilize around this. And right now, people are in the streets mobilizing about a whole lot of things. But is there any role for the public to put the pressure on, say, Congress or the courts or something to stop something like this?
I think that's already been happening in different ways through scientific organizations and societies. And for example, the American Society of Tropical Medicine and Hygiene that does a lot of global health research, and everything from maternal newborn child health to parasitic diseases, especially malaria, has been strongly sending messages through their congressional contacts and the CDC and NIH about this change. So I think there are a number of examples of organizations that are trying to lobby to say this is not a good decision.
No, right. So I'm glad to hear that. We're a little relieved to hear it. Maybe this will be reversed. It was just a terrible shock. Dr. Hamer, you have been just wonderful to give us all this information with your hectic schedule. Thank you ever so much. Good luck in this great effort on your part. Please keep writing those articles to inform the public. Thank you.
Okay, my pleasure. Thank you very much for having me.